friends, welcome back. I'm so glad you're here today because today we are talking about what happens at the first gynecologist visit. So stay tuned. Okay, if you saw my last TikTok, I covered what to do to prepare for your first GYN visit. If you haven't seen that one, pause and go back and watch that one. Okay, welcome back. So now we're talking about what actually happens at the first GYN visit, because sometimes it's like this mystery of like, oh, I don't know, I'm going to the vagina doctor and what actually happens down there and I don't know what to do and I've heard horror stories. What's actually true? Well, that's what we're going to talk about today. First things first, gynecologist visit starts off like any other. We call you back to the room, we get a height and a weight. If you don't want to know your weight or you have some weight sensitivity issues, let the medical assistant who's doing that know beforehand. She can either not weigh you or she can weigh you turned around and not tell you the number if that's something that potentially causes you distress, and that's okay. Just let us know. So when we meet you for the first time, we want to get to know you. So we want to know your history. We want to know any medical diagnoses you've had before, like asthma, high blood pressure, if you've had any surgeries before, if there's any significant family history, we'll go through that. We also want to know about your periods. So when you had your first period, if you've had your period, what it's like, how many days you bleed for, how frequently, how are they like for you? Do you have any history of any infections like gonorrhea, chlamydia, herpes, any previous diagnoses of any abnormal pap smears, which you might not have if it's your first visit to the gynecologist office, but not always. That's why if you bring somebody to the office, you want to be sure that you're okay answering these questions in front of them. Ideally, your doctor should have your support person step out so that you guys can talk one-on-one, but sometimes they don't always and it gets a little awkward. And we want to know your whole history so that we can help you best. But we will talk about confidentiality in another YouTube. So we ask a lot of questions. We want to know what medications you're taking, that sort of thing. And then we will specifically ask you if you have any specific concerns or questions related to your ovaries, your uterus, that sort of thing. So it might be birth control, or are your periods heavy or uncomfortable? How is sex? Is it painful or uncomfortable? We will ask you if you're sexually active, and hopefully your healthcare provider will ask you if you're sexually active with men, women, or both, and not just assume that you're heterosexual. I am hoping that has gone by the wayside more frequently, but if they don't be afraid to point it out. If you're like, yeah, I am sexually active, but I have sex with women, and that's why I told you I don't want birth control. In regards to answering these questions, we've heard it all. We've heard it all, and we've seen it all, and I promise there's nothing you can say that will shock us. So do not worry. Be honest with us, because that's the only way that we can partner with you and help you best. Okay, so now we've done a whole lot of talking. You're probably wondering, ooh, what about the exam? So here's the deal. If it's your first visit to the gynecologist, you might not need a pelvic exam. So pelvic exams are different from pap smears. A pelvic exam is when we look at the outside of the vulva, make sure everything looks okay, and then we insert 2 fingers into the vagina and 1 hand on the abdomen, and what we're doing is we're feeling the cervix and the uterus as well as the ovaries to make sure they feel healthy and normal. That is different from a pap smear, which we do to do cervical cancer screening, and that should only be done at the age of 21 or later. We do not do it earlier than that for a multitude of reasons, and I'll probably get into that at some point, unless you have some specific high-risk concerns. A speculum exam is what we do when we place a speculum into the vagina to be able to see inside the vagina and the cervix. And so the reasons we might do a speculum exam might be to do that pap smear, aka that cervical cancer screening. We might also do it if we need to take a look at the cervix to see if let's say you might have some concerns about discharge or some abnormal bleeding, and we need to look at the cervix and take a look. We might also do it if we need to do some sexually transmitted infection testing, although not all necessitate that. And of course, we'll do it if we need to place something in the uterus, like an IUD. This is what a speculum looks like. Some are metal, and these are reusable, and some are plastic, which are one-time use only. So I'm actually a fan of the metal ones because I think they're nicer. When they open up, they don't make loud clicky noises like the plastic ones do, but that's sort of a minor difference. But I like that these don't go in a landfill. They can be cleaned and sterilized and used again, whereas the plastic ones are one-time use only. So what we do is when we place this into the vagina and we open, that's how we can see into the cervix. I will go into another exam about what to expect from pelvic exams and pap smears and what's normal and what's not. I've covered those on my TikToks and my Instagram too, but we'll cover that in more detail here too. So getting back to it, doesn't mean just because you go to the gynecologist you're going to have a pelvic exam. Not necessarily. If you've got no concerns, no concerning history, you don't need cervical cancer screening, and maybe you're just going because you want to get started on birth control and you're thinking of using something like the birth control pill or the patch or the ring or depot, or even the next one on the arm implant, there's no real reason that we need to do a pelvic exam. And guess what? If your doctor or your healthcare provider suggests a pelvic exam and you are not comfortable, you are allowed to say no. You are also allowed to say, I don't want to today, I will come back. I'm just feeling a little uncomfortable right now. That is absolutely okay. At your GYN visit, we'll also ask if you are interested in sexually transmitted infection testing, and I'll get into that in another YouTube. In general, testing includes testing for things like gonorrhea, chlamydia, HIV, syphilis. We may also test for some additional things as well, but it just depends. You may also be eligible for a breast exam, and again, this depends on the age and if you have any concerns or symptoms. If you're not comfortable, you can let us know, and we may still recommend it, but that may be something that you can return, or we can give you some guidance on how to do self-breast exams. But a clinical breast exam done by a healthcare provider is important for certain populations, and we'll get into that more in another YouTube. So who's in the room at the GYN visit? Well, of course, your healthcare provider, a support person if you brought them, although they may be asked to leave so that you and your healthcare provider can have a confidential discussion. Your doctor's nurse or medical assistant may also be present in the room, and that may be so that your doctor can have instruments handed to him or her, or just as part of office policy. The reason being that way there's a chaperone there. The sad story is that sometimes medical legal things happen, and that chaperone is there both for the protection of the physician as well as the protection for you. And they can be really nice sometimes because you can be distracted by them and have some conversations with them while your doctor is examining you if you want some distractions. At the end of the day, your first gynecologist visit should not be something scary. You should feel that you've met with a doctor or a healthcare provider who you feel like you can say anything to, and you can let us know about any of your concerns or any of your needs for birth control, help with painful periods, help with painful sex, not feeling safe at home, feeling depressed, anxious, wanting to talk about future family planning concerns, anything and everything. We're here for you, and we can also help make referrals if we are not the right people to treat you. Please do not feel that anything in our office is something you need to be ashamed about, especially your vulva. And I talked about this beforehand when it comes to preparing for the gynecologist office. You do not need to do anything to your vulva or hair. We don't care if you shave or wax or trim or anything. And in fact, please leave it alone because it has a purpose. But if you do, that's fine. But please don't do anything special for us because we do not care. At the end of the day, when you leave the office, you should feel that you've got all your questions answered, you've got a good follow-up plan, and you know how to get in touch with us if you need us. I hope that helps decrease your anxiety a little bit when it comes to seeing the gynecologist for the first time. I know when I was in your shoes, I was pretty scared too. And then when I went, I thought, this wasn't so bad. And I felt like a real grown-up afterwards. So I would love to hear in the comments if you found this helpful or what your experience was like. Go ahead and follow me on Instagram and TikTok for more. And please like and subscribe so that you get notified every time one of these YouTubes goes up. I will post every Friday. I'll try. And I thank you so much for being here and supporting me. Bye-bye.